Hello everyone, my name is Angela Fraser and I would like to welcome you to this online course. In this course, we will be discussing and learning how to interpret an EKG strip and why. We will also be learning the most common rhythms seen on an EKG strip. I want to remind you, this course is not intended for you to become an expert in EKG readings, but to become familiar with the readings to be a safer nurse. First of all, let's talk about what an EKG machine is. WebMD describes an EKG, or an electrocardiogram, as a test that checks for problems with the electrical activity of your heart. An EKG translates the heart's electrical activity into line tracings on paper. The spikes and dips in the line tracing are known as waves. An EKG can be done to check the heart's electrical activity, explore causes of unexplained chest pain, find the cause of symptoms of heart disease, such as shortness of breath, disease, or fainting, find out if the heart walls are too thick, which is called hypertrophy, check how well medications are working, check how well mechanical devices such as pacemakers are working, or to check the health of the heart when a patient has other diseases such as high blood pressure or high cholesterol. Now that we have an idea of what an EKG machine does, here's an example of an EKG strip. The horizontal axis of the paper records time, with the black marks on the top marking 3-second intervals. Each second is marked by 5 large grid blocks, which each block equaling 0.2 seconds. Within the larger blocks are 5 smaller blocks that each represents 0.04 seconds. Here's an EKG strip. Notice the spikes and dips, or waves on the strips. An EKG strip can be very difficult to read, but with practice makes progress. In an EKG strip, there are 6 different waveforms, labeled P, Q, R, S, T, and U. The P wave is the first tiny upward movement of the EKG tracing. This indicates the atria are contracting and pumping blood into the ventricles. Next is what is called the QRS complex. The Q is normally the first downward deflection, R is the tall peak, and S follows by a downward wave. The QRS complex represents ventricular depolarization and contraction. The PR interval indicates that the transit time for the electrical signal to travel from the sinus node to both of the ventricles. The T wave is typically a smaller upward waveform which represents ventricular repolarization, meaning the ventricles are at rest. The U, which is not always present, indicates the recovery of the Purkinje conduction fibers. In an EKG strip, we must first determine the heart rhythm. For ventricular rhythms, we look at the R to R intervals on the strip, which we use a caliper for, to make sure that they are the same distance apart. It is okay to be within a few tiny boxes different. For atrial rhythms, we do the same thing, but instead of the R to R intervals, we do the P to P intervals. Now we must determine the heart rate. There are multiple ways we can do this. The first way is to count the number, or QRS complexes, over a 6-second interval. Remember, the strip will show you the 3-second intervals, so you will be counting the complexes within 2 3-second intervals. Then you multiply that number by 10. So for example, if I counted 7 QRS complexes in the 6-second interval, I would have a heart rate of 70. The second way to determine the heart rate is to count the number of small boxes between 2 R to R intervals, which are the tall peaks. Calipers are used to trace these small boxes. After counting the number of small boxes, you would then divide this number into 1500 to determine the heart rate. So P waves. We must ask ourselves a few questions. Do you see the P waves? Are they occurring regularly? Is there one for every QRS complex? Do all the P waves look the same? In a normal sinus rhythm, the P waves are present, regularly occurring, 1-to-1 P waves to QRS complexes, and they all pretty much look the same. All right, let's take a look at the PR interval. We must use our calipers here again. To measure the PR interval, we measure the beginning of the P wave, which is when it leaves the invisible line, until the Q occurs and leaves the invisible line. This is normally 0.12 to 0.20 seconds in adults, which is about 3 to 5 small boxes. Here we must ask ourselves, does this interval fall within the healthy range of 0.12 to 0.20 seconds, and is it constant? The QRS complex shows ventricular depolarization, which triggers ventricular contraction. Here, we must take our calipers to measure from the end of the PR interval to the end of the S wave. Remember, the beginning and the start of the wave are based off of when the wave leaves the invisible line. This is normally 0.06 to 0.12 seconds, which is 1.5 to 3 small boxes. Here we must ask, does the interval fall within the normal range of 0.06 to 0.12 seconds? Do all the QRS's complex look similar? Remember, the T wave indicates repolarization for the ventricles, meaning the ventricles are at rest. This wave follows the QRS complex. Keep an eye out for the T waves that are downward. The U wave, which is not always seen, would follow the T wave. We must also measure the QT interval, which represents the time of ventricular activity, so the depolarization and the repolarization. It's measured from the beginning of the QRS complex to the end of the T wave. Normally, the QT interval is 0.36 to 0.44 seconds, or 9 to 11 small boxes. Now you have an idea of the basic parts of an EKG strip. Now the difficult part is actually interpreting what the rhythm is. There are many different rhythms. Some that come without symptoms are okay, and some that are considered lethal or deadly. We really need to watch out for. I don't expect you to be able to remember all the different rhythms, but I'd like you to be familiar with them and practice them. So let's take a look at a few different sinus rhythms. These all happen to be within the SA node. So here is your perfect normal sinus rhythm. The rhythm's regular, heart rate is within range, normal, P to QRS 1-to-1, PRN is in range, QRS, there's no problems, which means no treatment. Here is sinus tachycardia. So it's normal, just the heart rate is faster, above 100. Remember, 60 to 100 is normal heart rate. So here, if the patient is showing symptoms, you would just treat the underlying cause. Here is also, just like the normal sinus rhythm, just slower. So it's less than 60. A patient may or may not be symptomatic with sinus bradycardia. If symptoms do appear, treatment can include atropine or a pacemaker. This is actually supposed to be titled sinus arrhythmia. So in a sinus arrhythmia, it's normal, but the rhythm is irregular, and the heart rate increases with inspiration. The heart rate can be normal, 60 to 100, or slow, 40 to 60, but everything else will be in range, and there's no treatment needed here. Sinus arrest. In this case, there is an irregular pause in the regular rhythm. This can be caused by failure of the SA node to fire an impulse. If pauses are long or frequent, patient will be given the same treatment as sinus brady, which is atropine or a pacemaker. So some atrial arrhythmias that happen outside of the SA node. Here is a premature atrial complex, which is irregular. This can be caused by too much nicotine, caffeine, anxiety. The strip is usually regular except for one beat. Here the P wave is present but abnormal in size. The PR and QRS are normal. The underlying causes must be treated if the patient is symptomatic. Here is atrial flutter. You'll notice the sawtooth. What happens here is the ectopic pacemaker discharges impulse at a very fast rate, and the rate is 250 to 400. The ventricular rate can vary. This can be very serious and can be treated with cardioversion or medications such as DIG. AFib, here the pulses are too fast and it causes the atria to quiver instead of contract. Here the heart rate is 350 to 600. With AFib patients, drugs such as cardizem or DIG are given and possible cardioversion as well. So I just wanted to show you guys some of the lethal rhythms. Here is VFib, which everything is out of whack. Treatment requires immediate CPR and other code measures. So notice you can't tell anything here. Asystole, this is when you are flatlining. This also requires immediate CPR combined with IV epinephrine. It's so important to be able to recognize and differentiate cardiac rhythms. On telemetry floors, the CMUs, also known as central monitoring units, help nurses watch their cardiac monitors. So for those who are on continuous telemonitors, they're always being watched. It is up to the medical team to interpret a problematic rhythm quickly and correctly. The interpretation of the rhythm determines the treatment. I hope that you have a small understanding of what an EKG strip looks like, along with a few examples. I expect the modules will help you understand the material more in depth. I look forward to hearing your feedback in the course. Please let me know if you have any questions or concerns.